Good morning, everybody. This week we're going to be talking about the vertebral subluxation complex. So to start it off, I want you to pause this video and ask yourselves, what is a subluxation? Talk about it, get answers from a couple people, and then unpause the video. So you probably heard a slightly different answer from each person, coming from a different viewpoint or a version of an explanation. So who was right and who was wrong? Well, hopefully everybody was right, unless you said something real silly. Then you might be wrong, but most likely everybody was right and hit on a different version of the topic. This is because the vertebral subluxation complex is, well, complex. As we know, everything in the body is connected, and processes throughout the body rarely occur independently. There are many parts of this complex that occur concurrently and are intimately intertwined. One's not really happening without the other. Basically, you can talk about a subluxation in many different ways, which is why it's important for us to understand these components and utilize the different viewpoints when educating our patients. This will allow us to tailor our communication to better serve their individual perception and facilitate actual comprehension. So fill the blanks in for them where they're missing that connection there. Understanding the why will help contribute to their ability to have hope. So looking at this picture here, we'll see there's 5 components of the VSC. So there's different ways, even outside of this photo, to talk about it, but here's a pretty simple one. I'll start off with joint dysfunction. So the vertebra lose their normal position and motion, which this sets in motion the additional components, which leads us to muscle dysfunction. The muscles supporting the spine can respond to the change in position or abnormal motion by weakening or tightening and going into spasm. So soft tissue dysfunction also occurs. This is the inflammation, swelling, and edema in the surrounding disc, ligaments, and tendons. And the pathophysiology of it all, loss of the body's proper homeostasis. So this includes the development of spinal degeneration, development of scar tissue, and then long-term nerve dysfunction that causes, as we know, other systems in the body to malfunction. But most importantly, that nerve dysfunction component. Nerve compression can lead to obvious symptoms such as nerve pain, but what we typically see and is more common for a subluxation to place silent stress on the nerve, affecting its ability to transmit signals between the body and brain. So you'll notice a lot of times patients will only be talking about one of these components. So I want you to take that puzzle piece they give you and appreciate it and help them by playing a role in creating the bigger picture. So I want you to do this by asking questions so that they can come to drawing their own conclusions about how these puzzle pieces fit together to form the entire subluxation complex. This is why we hear so many different complaints from different patients. Like, I can't turn my head to check for cars. I can't sit up straight. I think it's just a muscle problem. I need a massage. It hurts my back even if I just lay on the ground. All of those are just tiny little pieces that we need to use to show them the big picture of what's actually going on. So this week, I want you to help your patients understand the pieces of their puzzle so that they can see the bigger picture. It's not just a muscle problem. It's not just a posture problem. It's a spine and nervous system in a state of disease. Thanks, guys. Go get it.